We spent a lot of time on medical AI, really focusing on how it processes language, right?
Yeah.
Doctor's notes, research, patient histories.
Yeah, all text-based stuff.
Exactly. But when you actually go to the doctor, I mean, think about it. So much of what leads to a diagnosis is visual.
Hmm. Absolutely. Like a dermatologist looking at a weird mark or
Or a cardiologist looking at an EKG printout or an eye doctor peering in.
yeah.
That visual info is just, it's critical.
It really is. And that's why this latest development we're diving into today is pretty exciting stuff.
It comes from Google, right? Their AIE system.
That's the one. AIE, Articulate Medical Intelligence Explorer. And the big news, based on their recent research, is they've given it the ability to understand visual medical data.
So it can see now, in a way, not just read text.
Precisely. It's moving beyond just language processing to interpreting things like images,
Yeah.
medical images. That's a huge step.
Okay, so that's our mission for this deep dive then.
Yeah.
Figure out how they did this, what the results look like so far, and what this could all mean for healthcare down the line.
Right. Because, as Google points out, even normal human conversation gets a massive boost from sharing pictures or documents.
Yeah, text-only AI was definitely missing something fundamental in medicine. So it's not just that it can look at a picture of a rash.
No, it's more profound. It's potentially unlocking a whole new way for AI to understand things in a field where seeing is often believing. It could really change the game for AI diagnostics.
So how did they enhance AMI to do this? What's the tech behind it?
Okay, so the key is they've built upon AMIE's architecture using their Gemini 2.0 Flash model.
Gemini, that's Google's big, powerful AI model series, and Flash implies it's fast.
Exactly. Build for speed and efficiency, which you definitely need for like real-time chats. But it's not just a better model. They also added something they call a state-aware reasoning framework.
Okay, state-aware reasoning framework. Let's try and unpack that a bit. Sounds complex.
It does, but the idea is fairly intuitive, actually.
Does it mean the AI remembers things? Like it keeps track of the conversation?
You've got it. It means the AI isn't just running through a fixed list of questions. It actively remembers the information it's gathered already.
Oh, okay.
And then it adapts its conversation. It figures out what it knows, what gaps there are, and what it needs to ask next. Sort of like it has a working memory of the consultation.
That sounds much more like how a human doctor works, right?
It really mirrors that process. A doctor takes your history, starts thinking about possibilities, and then asks for specifics. Crucially, they might ask to see something. Can I see that rash? Or do you have your latest blood test results?
Right, they ask for visual evidence.
Exactly. And this framework lets AMI do the same thing. It can request relevant visual artifacts like a photo or a lab report image when it makes sense.
And then it can interpret what it sees in that image.
Yes, interpret it accurately, and then weave that visual information back into the conversation to refine its diagnostic thinking.
Okay, so it's actively using the visual input, not just acknowledging it. That
Yeah.
makes sense. But how do you train an AI for that? It's not just about showing it photos, surely.
No, definitely not. It's complex. To train and evaluate AMI on handling both text and images, what we call multimodal data.
Multimodal, right? Text and visuals combined.
Correct. Google developed a pretty sophisticated simulation lab.
Yeah.
They created very lifelike patient scenarios.
Using real data.
Yeah, they used huge amounts of realistic medical images and data from established, respected sources.
Yeah.
Things like the PTB XL ECG database for heart stuff
Okay.
and the SCIN dermatology image set for skin conditions. So good quality, reliable data.
Got it.
And to make the simulated patients feel more real, they actually used their Gemini models to generate plausible backstories and histories for them.
Wow. Okay. So AMI then talked to these simulated patients.
Exactly. It interacted with them via chat in this controlled environment, and its performance was automatically evaluated, things like diagnostic accuracy, and importantly, whether it made stuff up, hallucinated.
Right. Avoiding hallucinations is key. So that's the simulation training. But how do they test it with, well, actual people or something closer to it?
Good question. That initial simulation work is crucial, but you need to see how it fares in a more human-driven setting. That led them to the next step, the virtual OSCE.
OSCE. Objective structured clinical examination. That's like a standard medical school test, isn't it?
That's the one. They basically created a remote version. They designed 105 different medical scenarios, but instead of simulated patients,
He used real people.
real actors, yeah, trained actors who consistently portrayed specific patient roles and conditions.
Okay.
And these actors interacted through a chat interface, either with the new multimodal AIE or with actual human primary care physicians for comparison.
And crucially, they could share images through this chat.
Yes, the interface allowed the actors playing patients to upload relevant images, like a picture of a skin lesion or an ECG readout, just like you might in a real telehealth situation.
Okay, so this is getting much closer to a real-world test, combining chat with visual evidence sharing. What happened after these interactions? How did they figure out how well AMI did compared to the human doctors?
The evaluation was really quite thorough. They had specialist doctors, dermatologists, cardiologists, internal medicine specialists review the anonymized transcripts of all these conversations.
What were the specialists looking for?
A whole range of things. How well history was taken, the accuracy of the diagnosis, the quality of the suggested treatment plan, communication skills, even empathy.
Empathy. Interesting they measured that.
Yes, and critically, they also scored how well AME and the human doctors interpreted the visual information shared by the actors.
Makes sense. And did the actors give feedback too?
They did. The patient actors also rated their experience, how they felt interacting with both the AI and the human physicians.
All right, so this leads us to the results, the really interesting part. What did they find? Did adding the eyes make a difference for AME?
Well, yes. The results, keeping in mind this was a controlled study, were quite striking.
How so?
Google reported that in this setup, AMIE often outperformed the human primary care physicians in several key areas.
Outperformed actual doctors.
Oh.
On what specifically?
Okay, so according to the specialist evaluations, AMIE was rated better at interpreting the multimodal data, integrating the text chat and the images effectively.
Okay, better data interpretation. What else?
Higher scores for diagnostic accuracy. The specialists felt AMIE's differential diagnoses. The list of possible conditions were more accurate and more comprehensive for the cases presented.
More accurate and comprehensive diagnoses? Wow.
And there's more. They also rated AMI higher for the thoroughness of its diagnostic workup, the soundness of its management plans, and importantly, its ability to flag urgent situations correctly.
That's quite a list of advantages. Better data use, better diagnosis, better planning, better urgency detection.
But what about the bedside manner? The human touch? AI often gets criticized there.
That is a crucial question, and honestly, the findings here were also really surprising.
No one.
The patient actors, remember, the real people playing patients, they often perceive the AI as being more empathetic and trustworthy than the human doctors.
Wait, really? More empathetic? How does that work in a text chat? It's a fascinating finding. Now, we absolutely have to stress this was text-based interaction only. The nuances of face-to-face or even video calls are completely different. But in this specific context, yeah. More perceived empathy from the AI.
That is genuinely surprising. It definitely makes you think about how we perceive empathy in digital communication.
Yeah.
What about errors, though? Did the AI see things that weren't there in the images? Hallucinations?
A critical point. Absolutely. Safety first. Encouragingly, the study found no statistically significant difference in image-based errors, these hallucinations between AMI and the human doctors.
So within this study context, the AI wasn't making significantly more visual mistakes than the physicians.
That's what the data showed, yes.
Yeah.
Which is a positive sign for safety, at least in this controlled setting.
And are they stopping there or pushing it further?
Oh, they're definitely pushing further. They've already done some early tests using an even newer model, Gemini 2.5 Flash, within their simulation environment.
Any hints of improvement?
The preliminary results hint at potential further gains in diagnostic accuracy and the quality of management plans. But, and this is important, the researchers are very clear. These are early findings. They need thorough validation by expert doctors to really confirm any benefits.
It's definitely impressive progress, but Google themselves are highlighting the limitations here, aren't they? This isn't something you'll find in your doctor's office next week.
Absolutely not. And they are very upfront about that, which is responsible. They stress this was a research-only system.
Right.
It was tested in a specific OSCE-style evaluation using actors. That setup, while great for research, just doesn't capture the full messiness and complexity of real-world medicine.
Yeah, real patients, busy clinics, unpredictable situations. It's different.
Completely different. And it doesn't capture the richness of being in the room with a doctor or even a proper video call. Simulations have limits.
So given those limitations, what are the concrete next steps to move this from the lab towards maybe clinical reality someday?
They're being careful and methodical. Google has already partnered with Beth Israel Deaconess Medical Center.
Okay, a major hospital.
Right, for a real-world clinical study. That's a vital next step, testing it in actual clinical settings with real patients who give informed consent.
That feels like the necessary bridge to cross.
It really is. And they also acknowledge the need to move beyond just text and still images eventually. The goal is to handle real-time video and audio too, which is obviously huge for telehealth.
Okay, so wrapping this up, it feels like giving AI the ability to see medically is a really significant move.
Yeah.
We're shifting from just language to interpreting these vital visual clues.
It seems that way. It taps into something fundamental about how medicine is actually practiced.
But, as you've stressed, while the results are promising, even intriguing.
The journey is still long. Getting this from promising research to a safe, reliable, everyday tool for doctors and patients, that requires a lot more work, careful progress, and rigorous real-world testing.
Absolutely. This whole development makes you wonder if AI can start processing visual medical data this effectively, what's next? What other kinds of information could AI learn to interpret? Could it analyze, say, the sound of a cough through a microphone with similar accuracy?
Yeah.
Or other sensory inputs we haven't even considered?
That's a fascinating thought, extending beyond visual.
Yeah. How might that change not just healthcare, but potentially our whole relationship with technology across the board? It's definitely something profound to think about as these capabilities continue to expand.